Hello everyone. I am Dr. Susan. I am a specialist for ADHD disorder. I would like to share with you helpful information about ADHD disorder. Attention Deficit Hyperactivity Disorder. This is a disorder in which a person is unable to control behavior due to difficulty in processing neural stimuli, accompanied by an extremely high level of motor activity. ADHD is one of the most common mental disorders in children and adolescents. The symptoms of ADHD fall into three main areas: hyperactivity, impulsivity, and also inattention. Here are a few other ADHD symptoms you may take notice of. This includes difficulty staying focused, difficulty controlling behavior, and very high levels of activity. Fidgeting and squirming, non-stop talking. Dashing around, touching or playing with anything and everything in sight. Constantly in motion. Have difficulty doing quiet tasks or activities and being very impatient. Blurting out inappropriate comments, showing their emotions without restraint, and acting without regard for consequences. Have difficulty waiting for things they want, or waiting their turns in games, and known to often interrupt conversations or others during activities. Now, you might be asking yourself, what are the causes of ADHD? Well, scientists are not sure what causes this disorder, although many studies suggest that genes play a large role. In addition to genetics, researchers are looking at possible environmental factors and are studying how brain injuries, nutrition, and the social environment might contribute to ADHD. Some believe that taking a prescription drug will eliminate the problem. Medication is not the only answer. Stimulants such as Ritalin and Adderall are often prescribed for attention deficit disorder, but they might not be the best option for your child. And they are certainly not the only treatment. The bottom line is that medication is a tool, not a cure. And it is most effective when combined with other treatments that address emotional and behavioral issues. There are treatments and medications for ADHD such as behavioral therapy treatment. Behavioral therapy, also known as behavior modification, has been shown to be a very successful treatment for children with this disorder. It is especially beneficial as a co-treatment for children who take stimulant medications and may even allow you to reduce the dosage of the medication. Behavior therapy involves reinforcing desired behaviors through rewards and praise and decreasing problem behaviors by setting limits and consequences. Home treatment. As a parent, you have a huge influence over your child's treatment. Evidence shows that eating a healthy diet, getting plenty of exercise, and making other smart daily choices can help your child manage the symptoms of ADHD. That means your child can begin treatment for the disorder today and at home. Take into consideration about the benefits of green time. Studies show that spending time in nature can reduce the symptoms of ADHD in children. Encourage your child to play outside for at least 30 minutes each day, if possible. Also look into ADHD sleep treatment. Regular quality sleep can lead to vast improvement in the symptoms of ADHD. For example, set a regular bedtime and enforce it. If background noise keeps your child up, try a sound machine or a fan. Turn off all electronics. This includes a TV, computer, or any form of video games, and yes, even an iPhone. At least an hour before bed. Limit physical activity in the evening. For professional treatment for ADHD, always know that ADHD specialists can help you develop an effective treatment plan for your child. Since this disorder responds best to a combination of treatments and strategies, consulting several specialists is advisable. There are ADHD treatment providers you may want to contact, such as your primary care physician or your child's pediatrician, your insurance company, officials at your child's school, local hospitals or clinics, even a local parent support group. There are different types of ADHD specialists. Read the list posted and see what each one can provide and do to help. Students with ADHD present the following challenges. They demand attention by talking out of turn or moving around the room. They have trouble following instructions, especially when they are presented in a list. They often forget to write down homework assignments, do them, or bring completed work to school. They often lack fine motor control, which makes note-taking difficult and handwriting a trial to read. They often have trouble with operations that require ordered steps, such as long division or solving equations. They usually have problems with long-term projects, where there is no direct supervision. They do not pull their weight during group work and may even keep a group from accomplishing its task. One of the most important concerns are family challenges with ADHD and how it affects family functioning. Dr. Russell Barkley, Ph.D., and a leading ADHD expert, describes a vicious cycle that he often sees in ADHD families, where a child's ADHD-related behavior is both the cause and the effect of family problems. Read the list posted, and then pause this presentation to reflect or discuss each topic with a colleague or group. Now, let's focus on the teacher's role and challenges. Anything a teacher does to help their students with ADHD will benefit all students in the class. However, to successfully teach a child with ADHD, teachers must understand their hidden disability, along with its behaviors and challenges. They need to reach the student on a meaningful level, focus on the child's strengths, inspire and motivate. This requires commitment and a great deal of energy. Remember, consistency is key. In order to encourage positive change in all settings, children with ADHD need consistency. It is important that parents of children with this disorder learn how to apply behavioral therapy techniques at home. Children with ADHD are more likely to succeed in completing tasks when the tasks occur in predictable patterns and in predictable places, so that they know what to expect and what they are supposed to do. This can be achieved by following a routine. Use clocks and timers. Simplify your child's schedule. Create a quiet place and set an example for good organization. Now, before I go, please keep in mind the importance of praise. As you establish a consistent structure and routine, keep in mind that children with ADHD often receive criticism. Be on the lookout for good behavior and praise it. A smile, positive comment, or other reward from you can improve your child's attention, concentration, and impulse control. Reward your child for small achievements. These will lead to bigger successes down the road. I hope you found Cecilia's presentation helpful and informative. For further facts about ADHD, you can research through websites like medicinenet.com and insidehd.org.